watch at a later. So again, welcome to today's ECHO session. If you can take a minute and put your name and contact information into the chat, that'd be fantastic. It just helps us know who is on the call, where we're all from, and as a way to just get to know everybody. We are recording today's session, and like I said, it will be on our Canvas page as well as on our YouTube channel. Here's a way to rename your profile in case you have not, don't know how to do that, but if you could put your name and where you're from, what your discipline is, it just helps us know who's on the call, being able to get to know each other. You can raise your hand if you have any questions. You can put those in the chat, as well as raise your hand and we'll give you a call on that. Every time I move my cursor, I can't move forward. So sorry about that. When we are talking about cases or any information, please just remember to avoid using identifiable information like first, middle, or last names, where they work, their email addresses. We just want to make sure that we're keeping everything confidential. ECHO, if you've never been on an ECHO session, we are hoping that we get to know everybody in our community, our interactive virtual community. So please take a minute and turn your cameras on if you feel comfortable to do so. Put your name and contact information into the chat, as well as changing your name. It just helps us then being able to know who we can reach out to. Maybe somebody had a great idea that I want to learn more about, and so I can reach out to you personally on that. If you've never been on an ECHO and you've never heard our case narratives are a great way to learn more from your colleagues and experts in the field. There's a great way to gain information and deal with any struggles that you may be having. So if you are interested, please consider doing that. Reach out to earlyecho@usu.edu. The key components of an ECHO are building that community of practice. We have a didactic speaker, as well as then case presentations and times to brainstorm that. Case studies are, again, just a way to get information from your colleagues, other people that are working in the field. And then the way that we do certificate of attendance is filling out those surveys at the end. Those surveys become really critical, not only for your certificate of attendance, but as a way for us to keep these sessions free to all of our participants. So please take a minute and fill out those surveys for us. I am going to stop sharing, and I'm really excited today to introduce Jason Fox, Lisa Smith, and Gabby. I'm not even going to attempt your last name. So, but
it's Baragoshi. It's what you see. It is pretty much straightforward.
Okay, they are going to be talking to us today about some of the great things that they learned down at their South Main clinic in regards to our Latinx Hispanic population. So Jason, I heard that you were the one who was sharing, so you should be able to share your screen and take over.
All right, let's see. Is everybody able to see my slides?
Yes.
Awesome. Well, great. I'll go ahead and get started. And then while we're going, if people have questions, you know, feel free to stop me, or we can put things in the chat, and then I'll let Gabby or Lisa sort of address those or tell me to address them. But first off, just want to thank you for letting us join you today. So Lisa, Gabby, and myself are excited to present our work related to improving engagement and education around early child development with Hispanic Latinx families. And then I'm hoping one of the themes you will see emerge throughout our project is that a multi-pronged effort with establishing multiple touch points of interaction with Hispanic Latinx families might help to meet them where they are at with so many variables to try and navigate. So I'm the division manager for general pediatrics here at the Department of Pediatrics at the University of Utah, and have administrative oversight for the South Main Clinic, along with Lisa Smith, who's also on the call, who's our clinic manager. And then I'm also an adjunct faculty for the UR Lend program. And just a little bit more about South Main Clinic. So South Main is a multidisciplinary clinic in a Salt Lake County Health Department building here in South Salt Lake. We see patients in pediatrics, family practice. We have a midwifery program. We have a high-risk OB clinic. And then we also provide dental services as well. So really a full scope clinic. We serve what would probably be considered a highly underserved population. In pediatrics, we see about a 80% Medicaid mix. And then when we flip that over to the adult population, we almost see that turnover on its head, and we have close to 70 to 80% of patients that would be considered self-pay. And so through the course of this project, and there we go, slides are advancing, I was able to be part of a UR Lend leadership group. And we were focusing on Learn the Signs Act Early at South Main. And I'll probably, just for sake of time, start to reference that as LTSAE through the rest of the project, just so we don't spend 20 minutes just having me repeat those exact same words. But a little bit about UR Lend. It's a postgraduate multidisciplinary training program. It focuses on leadership education in neurodevelopmental and related disabilities. And providers are trained to provide optimal services to children and adolescents with special healthcare needs. And then one key component is cultural competency, which I think fits particularly well with the discussion we were having today. And I was lucky enough to precept this group of talented graduate students that you see on the screen here, and help guide them down the path they would choose to develop to address this specific subject of how to implement LTSAE materials to the Hispanic Latinx community. And again, particularly we are focusing on South Main Clinic. And so for an overview of the project, here you can see some of the data on CLM populations, of which Hispanic Latinx comprise the largest group. Particularly interesting in our project was the final point of addressing the avoidance of utilization of our services. We found a big dip in patient visits during the COVID pandemic, disproportionately impacting this population, specifically in this age range, more so than in our other primary care clinical settings. And in general, I will just be referring to the age range that we focus on for Learn the Signs Act Early, those kiddos age 0 to 6. So then in terms of the background and significant, here you can see some of the negative impacts to patient care that this population is typically exposed to. And our goal was to really use the Learn the Signs Act Early campaign and materials to re-engage with this population, and then increase access to these materials, and then also get kiddos caught up on their well child check schedules to make sure that developmental milestones were being addressed, and if needed, appropriate referrals were being placed if further evaluation was warranted. So then in terms of objectives, here you can see the objectives the leadership group came up with, focusing on better understanding of barriers this population faces, informing the South Main staff about these barriers, and then again to properly engage and educate families with age-appropriate developmental materials addressing known milestones. So then community partners. Our main focus area, again, for this group was for South Main Clinic, again, multidisciplinary clinic in South Salt Lake. In addition to all of those clinical services that I mentioned, we all fall under the same roof with the county and also then have access to like Medicaid caseworkers, promotoras through Holy Cross Ministries, and then other standard county programs that you would see available at most county health department buildings. We also had Janelle, Preston here is the LTSAE ambassador for the state, who is up at Utah State University and was an integral part of this collaboration, and an advocate we worked with throughout the project, and leaned on her expertise quite a bit. And then I would also like to add one additional shout out to Judith Holt. She served as the co-faculty preceptor with me for UR Lend Leadership Group. So generous with her time, her expertise, and suggestions, both for myself as well as the entirety of the leadership team. So sincerely, Judith, if you're on the call, just thank you so much. So well respected and appreciated. So then our method or procedures. Here you can see some method procedure information, but basically the gist of it is we hope to capture the kiddos we hadn't seen back in our clinic since before COVID began, specifically the kiddos age 0 to 6, whom the LTSAE materials were designed for. So basically the kiddos that had been established in the practice and then we hadn't actually seen, we used since the end of December 19 as our cutoff for kiddos that we might have missed, to try and re-engage with those kiddos, especially the ones in, again, that patient age range that we talk about. So then survey results. The first thing we learned is that email may be kind of going the way of the dinosaurs. We actually sent out 2 rounds of email distributions and we got a whopping 10 responses. So at this point, we were thinking we were doomed before we ever got started, but we were able to try and use a new texting format available for patients in Epic here at the University of Utah. And amazingly enough, we found out that people tend to use these mini computers that we carry in our pockets and never let out of our sight. So our response rate went up a few thousand% in a matter of days. And I think we ended up literally just getting under 200 responses. So we were like so excited to see that. And I would say it's one of those things where we learn like, oh, over time, like trends change. I remember like being in the age of snail mail, where when email came around, it was like, oh my gosh, we have such a timely metric, but now even sort of emails going by the wayside. So slide number 9. So right here is the reason for the last visit at clinic. So here we are identifying concerns for development is something typically not parents identified for this patient population, as you can see from the first graph. And then in the second table, you'll also see we had a lot of parents identifying that they didn't need at least an annual appointment for their kiddos, which again, for this patient population just isn't the case. So maybe some sort of gap in education or understanding in terms of the components of like what an annual well child check would look once we go on to that annual cycle. So then the next thing we focused on is what presents you from clinic, or what presents you from coming to clinic. So even though we were in the middle of the pandemic, interestingly enough, it wasn't the lack of comfort of coming into clinic that was driving the absence. It wasn't thinking it was necessary. Not coming or not being able to take off time for work was the majority of the response, along with not thinking it was necessary. And I would say the transportation and time off of work have always been known barriers, but I don't believe that not thinking it was necessary was one we would have guessed to have such a high response level on at over 30%. So that was one of the ones that really surprised us. And then we have known for this patient population that many are working during the day, and we simply don't have resources to run our clinics in the evening. Although it seems clear that if we could, our patient population would really benefit from that. This is an example of a known barrier we have to try and work around again. How can we take another approach to get the results we are needing based on the needs of our population? And then here you see the Spanish-speaking patients compared to English-speaking. And you can see that for the Spanish-speaking, patients preferred to have more options for making regular appointments, which again, that one, I don't know necessarily really surprised us. So the one that did though, and that's our next slide, is where they learn about the resources. This is actually one of my favorite slides, I think, because it really identified a blind spot for us. Traditionally, we always thought that radio was the most popular way to get out information for the Spanish-speaking population in the Salt Lake Valley. We had always assumed that this drove a large volume. But actually in our survey, we see that for the parents of this age range of kiddos, it doesn't look like even radio or even TV really move the needle. And so maybe we were thinking of perhaps a little bit older patient population that might still access, whereas maybe younger generation that's having kiddos now really don't lean on those ways of communication like we thought that they would. So we learned that there are other ways to get out information through pathways that people are actually utilizing, not just ones that we perceive them to be utilizing. So then at this point, it's my pleasure to hand off to one of our experts. So Lisa Smith, our manager at South Main Clinic, who's also been a nurse at the clinic for many years. And I decided I will let her divulge how many years she has been at the clinic if she chooses to do so. So Lisa, if you want to take it away, do you want to drive and I'll stop sharing, or do you want me to just move slides along for you?
You can move the slides along because I'm sure I'll mess it up. Oh, I'd probably like close it. So as you said, I'm Lisa Smith. I am the nurse manager here at the South Main Clinic. I've been manager for about a year now. But before that, I was one of the clinical nurses, and I've been here a total of 13 and a half years. So it's been a while. So throughout this project, we worked with Janelle and the Your Lend group to put some new things into practice at the clinic to hopefully reach a larger Latinx population, and in general, you know, just those in the clinic. Okay, go ahead, next slide. So we formalized a developmental screening policy and procedure, and ensured this is just a piece of that policy that we put together. So every step of our team knows what their role is in developmental screening for our patients. We started to make notes in the visit notes and the scheduling so that our front desk could provide screening tools for patients to be filling out while they're waiting to be roomed. And then our rooming staff, the MAs and nurses, would ensure that those were complete and tallied for our providers to then look at the results and have a discussion with the families during their well check visits and discuss with them what milestones they're looking for, why we do the screeners, and how parents themselves can be a part of that screening process at home. We have given out various tools to parents to help work on that identification of developmental milestones at home. And then we also created a way to streamline how we refer to early intervention services for those kiddos that maybe aren't meeting the milestones as expected. And on this next slide, we'll show you a little bit more about how we did that. So we use smart text in our medical record to ensure that we gathered the correct information for the early intervention agencies in the area, so that we were communicating all the information, and that whatever provider was referring was gathering the same information. And then we can also then go back into that medical record and see who's been referred and what information was sent where, versus previously we had been using paper that may or may not have gotten scanned into the chart and followed up on later on to see if parents were actually connecting with agencies. Next one. And then in the parents after visit summary, we gave them this information on, you know, we're referring your child to early intervention because I think sometimes parents didn't really understand why we were making the referral, or maybe that was discussed during the visit, but then after the visit, they get home and they're like, I don't know, they said I need to do this. And parents weren't necessarily following through. And just in case the early intervention agencies weren't able to work the referrals as fast as parents were remembering to call, we gave them their contact information so parents could be proactive in contacting those agencies to get their kids connected. And I think, I mean, anecdotally, we didn't collect a lot of information on the follow-up. That's our next step. But I think a lot of more parents were more willing to engage in assessments with the early intervention agencies when they kind of they felt a little bit more in the driver's seat on that. And then all of our patients get the Bright Futures from the AAP in their visit summary to know, okay, between now this visit and the next well-child visit, what things do I as a parent want to look for, or should I expect my child to be meeting, and how can I be a participant in my child's care? Okay, next slide. And then we also, at every visit, go to the next slide, that's fine. The Yearland group put together some wonderful bulletin boards for our exam rooms that had the milestone trackers that are available through the CDC. And Janelle was able to get us copies that have a QR code that parents could scan while they're in the exam room to download the milestone tracker and be able to then track on their own. Because, you know, a lot of our young parents especially like to have that app, you know, they can pull up and find those milestones and go, oh, this is normal. Or, you know, maybe, you know, that comment that the provider said that they weren't speaking as many words as they would expect, you know, they can see it for themselves. And of course, you know, it's nice to have that in the exam room, or the parents, you know, have something that they can be doing while they're waiting for the provider. And then we also put the big posters up in the hallway, just to try and get it out there, that visual information about how important it is to watch for these milestones as their child is growing up. And then at certain intervals, we give out books. All of our well checks between 6 months and 5 years, we give a book. And so we modified which books to give out at certain ages to align with these books. And there's PDF versions available through the CDC that actually give little milestone tidbits for the parents in the book. So as they're reading to their child and promoting literacy, they can also be watching and reminding themselves to watch for some of these developmental milestones at different ages. And this next slide will show and like the inside of some of these books, where, you know, where's your nose? And then one of the tips as for milestones is ask your child to, you know, label body parts, or are we, you know, how can I as a parent engage in the screening for my own child? And all right, Gabby, you're up.
Oh, thanks, Lisa. So yeah, I will talk a little bit about the quality improvement project South Main Clinic was doing, or currently is doing. So my name is Gabi Baragoshi, and I'm a quality improvement coach here at UPIC. And before I talk about the quality improvement project, I would like to talk a little bit about UPIC. Next slide, Jason, please. Okay. So who and what is UPIC? So UPIC stands for Utah Pediatric Partnership to Improve Healthcare Quality. And we are a quality improvement organization that is part of a National Improvement Partnership Network, also called NIPN. NIPN is a network that spans over 20 states that have developed quality improvement partnerships with a strong focus to advance and transform healthcare for children and families. Yeah, thanks, Jason. So here's a map just to show you what states are involved in the NIPN network. And besides, you know, on the next, not on the next slide, but next to the map, I put some logos and some acronyms, and maybe you have come across some of the acronyms and logos in your past or current work, because I saw that there's people from other states on this call too. Next slide, Jason, please. So A little history about UPIC. So UPIC was created by Dr. Chuck Norlin and Dr. Paul Young in 2003. So both are retired pediatricians. They were working at the Utah Pediatrics Clinic. Our current UPIC director is Dr. Diane Liu. She's also a pediatrician, and she is practicing at the Sugar House Clinic and at the Utah Pediatric Clinic. So over the past 20 years, so we have been involved in a variety of quality improvement projects. And here I listed a few of those. Currently, one of our biggest projects we're working on is the mental health project. And we have practices involved from Logan down to St. George. So it's all over Utah. Thanks, Jason. Obviously, Jason can read my mind. That's very good. So here at UPIC, we are following the IHI model for improvement. IHI stands for the Institute for Healthcare Improvement. And basically, the model consists of 3 questions. So what are you trying to accomplish? How will we know that the changes we're implementing is an improvement? And what change can we make that will result in improvement? And the 3rd question, the last question, is answered by PDSA cycle. So PDSA cycle, PDSA stands for Plan, Do, Study, Act. So plan is come up with a change idea, do it, meaning implement the change idea into your clinic or practice or in your workflow. Then step back, study, analyze the data, and then act upon the results of the data to plan your next cycle. So PDSA cycles can be rapid cycles, can be done on a weekly basis, or can be done on a monthly basis. It really depends on the project and how long the project is. Next slide. All right, so let's dive into the South Main Clinic Act Early QI project. So as we know, the American Association of Pediatrics recommends surveillance and screening to identify children with delays and disabilities. And the recommendation is to do it on well-child checks and to use a validated tool. In doing that on well-child checks and using a validated tool, that really discourages providers the wait-and-see approach, which we know is not working, and children might fall through the cracks. So the SWIC, the Survey of Well-Being of Young Children form, it has 3 sections. It's the behavioral, the development, and the family sections. So for that QI projects we are doing with the South Main Clinic, we really focus on the development section of the SWIC form, and that includes assessing the milestones at well-child visits and also doing the POSI for autism screening. Next slide. So with every QI project, quality improvement project, you have to have measures, because if you don't have measures, how do you know that you're improving? So with the South Main Clinic team and the UPIC team, we came up with 3 measures for this project. The first 2 measures are already implemented, and we're doing data analysis and PDSA cycles. And the 3rd measures, and actually Lisa was mentioning it when she presented her part, it's still in the talks, and hopefully by end of this month, we know how to proceed on the follow-up measure we actually designed. So the first measure is the % of children screened for developmental delays at the 18 months, 24 months, and 30 months well-child checks. And with every measure, you got to have a numerator and denominator, and it's always good to also put a goal there too. So that gives the team something to work towards it. The second measure is then the children who failed their screener, did they receive a proper follow-up, or is a proper follow-up documented in the medical chart? And follow-ups can be the provider recommends a reevaluation in a few months. The provider recommends a child for a STAT test within the clinic to determine if there is a higher risk for autism, or the provider sends an electronic referral, and Lisa was showing us how the electronic referral form looks like, or the smart face in the EMR, to early intervention or to the UDAC clinic. And the referral follow-up would be the 3rd measure, but it's not implemented yet. So yeah, thank you. So here is the first measure. So here we are looking at the first measure run chart. As you can see that South Main Clinic is doing an awesome job. So here we are doing chart reviews on a monthly basis to see if the appropriate screener was used at the 18 months, the 24 months, or the 30 months well-child visits. And we started out looking at the baseline from last year and then worked towards our goal of 95%. And as you can see, for the last 3 months, South Main Clinic has been performing above the goal line, about 95%. And that is a very good indication that whatever processes South Main Clinic has implemented is actually sustainable. Because changes, as we all know from our own experience, changes for a short period of time are very easy to do. But to implement changes or implement new work processes that should sustain for a long period of time takes a little bit more of work. And so for the South Main Clinic, above 95% for the 3 months, they are in a very good spot of sustaining the implementation. And we're going to keep a close eye on that for the next 5 months. All right, thank you. So here's the second measure to see if the next step of referral is documented on the children who failed the POSI or the SWIC form. And again, South Main is actually doing a very, very awesome job. I cannot give enough shout outs to the South Main Clinic that 100%, if a child fails the screener, a follow-up process is documented. And the follow-up process can be that the provider, after talking to the family in more details, actually deems that the child did not fail the SWIC or the POSI and writes it in, or that the child failed it and the child is referred for further testing, or the child is referred to early intervention or to the UDAC center. All right, next slide. Oh, and actually that ends my presentation for you. And so if you have any questions about quality improvement or the project we're doing at South Main Clinic, please reach out to me. And I would actually like now hand it back to Jason.
Awesome. Thanks so much, Gabby. Get my slides to advance. All right. So as this is so I don't know if I explained in the detail of the clinic, but for pediatrics at South Main Clinic, we're actually a resident-based teaching practice. What that means is we will have a faculty attending that's overseeing anywhere, or is overseeing residents at the clinic. We have roughly 40 residents every year at South Main Clinic, and they're doing what they call their continuity or their outpatient experience. So basically they'll stay at South Main, and for the primary component of their residency program, they will establish and see patients at South Main. So because it's a resident-based teaching practice, we also, the leadership team wanted to introduce concepts and materials to the residents that might also help them better and engage and interact with this Hispanic Latinx population. And so we provided some education specific to cultural considerations and cultural competency for the Latinx population. That's here that you can see. And then in addition to that, we provided some information and education and training on what are referred to as pillars of psychological flexibility that we had found through our lit review at the beginning of the project with the leadership group. And actually the materials were very, very well received by not only the residents, but also by the faculty. And the faculty have decided that these are sort of teaching tools that they would like to continue to use post-project with incoming interns that come in for year 1 of their residency program every year in late June, early July. So radio announcement, typical PDSA fashion. From the beginning, of course, we were working under the assumption that going into this, the radio component would be so integral to our success that we had decided to create a radio announcement. Although now we know, based on the data that we actually got for this population specifically, perhaps this actually isn't the most appropriate way to reach families. But again, in typical PDSA fashion, in future iterations, we might choose to abandon this, since the data we got would indicate that maybe that wasn't super successful. And then we did also, and we won't have time to show the video today, but we also did develop a video for families to better understand what a visit to the clinic looks like. And then it patterns the expectations over the course of the visit of what the family would expect to see and how to interact with the provider. So then, in terms of future consideration, there were definitely some things we learned to help guide further iterations of what this work might look like. Again, texting was something that we found out was like super successful. So we'll definitely take that with us in any surveys that we do, not just specific to this population. And I think, again, sort of understanding that there are multiple angles to take. Some might be more successful than others. But in general, sort of from the research and in practice, really what we felt we came away with is that there doesn't seem to be one single way to reach our patients. And really sort of that multi-pronged effort that we've talked about might be the most effective to just try and get as many people involved as possible. So here you can see kind of some of the big takeaways we had. And it sounds kind of silly, but actually asking what difficulties and barriers people have seems to be a good starting point when starting a conversation. If I learned anything, I think it's surround yourself with experts like all the people that are on this call today, that you can kind of lean on, borrow, or steal shamelessly from these experts to make a project like this possible. And for me, sort of in ending, I would just say, you know, a sincere thanks to Janelle, Lisa, Gabby. You are the ones that really made this project happen. And we are all benefiting from your great work. So I think, Janelle, if it's okay, at this point, I'll probably just stop presenting. And then I'm assuming we kind of open it up to some questions and cases.
Yeah, so if anybody has any questions to ask about this project, now would be the time to do so. And I'm going to switch it to gallery view to see. One of the interesting things that I said I was going to open it up, but I want to just put this out to everybody, is on these projects, especially on this particular project, it showed that people or families are reaching out to WIC agencies to get developmental information or information in general about their children. Do you guys on the call have that same experience, or was that an aha moment like it was for us? So since I can see Jackie on my screen, what do your families use WIC? And
our families, I don't know whether they contact WIC with those developmental questions or not. That could be an aha for me to check out and make, you know, just to see. Most of ours come from medical, where the doctors are going through the development is just not where they think it needs to be. And so they make a referral, letting the family that they know. And the other part that comes to us is through CFS. And that's just a mandatory developmental check and then support if needed after that. But that's something to take a look at. And since I'm on the Head Start board at one of the areas in the state, I'm going to ask the WIC people that come to that meeting and just see where they're at with that.
great. I thought I saw someone else come on mute. Kim, okay.
Hi, how are you? With Health Choice Utah, we're one of the Medicaid plans. And this is interesting to me because I'm Latina and we get our, like when we have health fair events, we do it through the radio. We had one like 2 weeks ago in West Valley. We had over 1,000 people show up, and it was through radio. So that's interesting to hear, like by text message. So, wow. And we are doing everything you're doing when we do health fair events. By the way, there's one coming up this Thursday. It's through the University of Utah. It will be in West Valley. If you follow us on Facebook, Health Choice, I have the flyer on there. But yeah, it's going to be a great event. And we have flyers too, so we can help the parents navigate, like you guys were saying about the steps. En español se llama etapas. Like, you know, when you're 6 months old, 9 meses, all that. I'm sorry, I'm so Spanglish right now because I've been all over the place. But yeah, we do all of that to help our families. And we've had, since March, I kid you not, we've done over 100 events educating our families to go back to your doctor, get your vaccines. We even created a vaccine card to give to parents, to hand out to parents, because they don't do that anymore. Remember, they used to be like yellow cards. So Health Choice created one. So if anyone needs some, reach out to me. And then that way parents have a tangible record with them, because a lot of them don't know how to navigate the phones or look them up on the chart. So yeah, I just think it's interesting though that people weren't getting the message through radio. I don't know. I guess it depends.
Yeah, and I didn't know if maybe it was maybe like the age of parents, maybe sort of that demographic shifting a little bit. That was sort of my sort of guess or conclusion, but no, that's a good question. And we actually, I think Lisa would probably tell you that we agree completely about like the health fairs. And unfortunately with COVID, we really lost the ability to go to these health fairs for almost 2 years. And so we know we were losing people, families that way, because they were always so popular and such a wonderful way to sort of engage with the community. So yeah, that I think we echo that also as a successful tool.
I like the idea of the immunization card. I think it's very good, because families can put it in the refrigerator, and it keeps in the forefront on the mind to make appointments for the children for follow-up immunization.
Kim, just out of curiosity, are your children being brought to the health fairs by young parents, or are they being brought by grandparents?
You know what? It's both. We've done events because there's 2 of us. We service the whole state of Utah. We've been in Tooele, Magna, St. George, Ogden, everywhere, and it's a mix. In Tooele, I've noticed there were a lot of grandparents taking care of the children.
Because I'm just wondering, because the young people, I don't know, you usually go to the newer technology, but if it was grandparents that were getting the young people and their babies to those health fairs, it might be why the radio was so popular and worked so well.
Yeah, if you guys need any help or anything, just reach out to us. We're more than happy to help. We can also have your flyers with us. That's what we do with Midville CBC, Malahi Clinic. Like, we partner with everyone. So, I mean, we want to get the word out there. And we're also under the U now. They adopted us about 1.5 years ago. So.
Well, you might have every early intervention program in the state of Utah reaching out with their individual flyers on this call.
And we do that a lot, believe me. And there's also, we're going to have this event called Connect the Dots in different counties. We already had one in Salt Lake, Cache County. So what we do is we get all these CBOs together. You bring your cards, you bring your flyers, and then we talk about what we do as Health Choice. And then after that, all the CBOs get together and they talk about, hey, what services do you offer? What do you offer? Where do you offer them at? So yes, please reach out to me.
Yeah. Any other questions or comments on the South Main project? Judith, I see that you are on the call and you're being very quiet. And she's still staying quiet, so she doesn't want to share anything. Okay, well, Jason and Gabby and Lisa, thank you so much for sharing that with us. You are more than welcome to stay on as we discuss. So, because we are all kind of struggling, or I don't know if struggling is the right word, but we're all trying to brainstorm different ways to engage with our Latinx Hispanic population. I just wanted to kind of go through and have us all give ideas or thoughts on these couple of questions. So in your perspective, or in your companies or the places that you work, when you're meeting a Latinx Hispanic family in person for the first time, what do you do to become welcoming and respectful? And we're just going to stay in our big group. So if anybody wants to shout that out or come unmute.
I would say one thing at our clinic that we've tried to implement is to not make an assumption, especially about what language is spoken. And, you know, as our staff are introducing themselves, asking, what language do you prefer? You know, so that they're not assuming it's any language at all. And, you know, I think that has been received really well with our families, and that they get to be a part of that decision, and they're not just forced, so to speak, you know, into communicating in the language that that staff member assumes that they speak.
That's a great idea. How about Carrie? You came unmuted. At least on my screen you did. Carrie Well.
And I agree with Lisa. Sometimes you have to ask them, what language do you prefer? Because like the younger generation Latinos, they'll get upset if you start talking to them in Spanish. They'll answer you in English and you're like, oh, sorry. You know what I mean? But no, Lisa, I totally agree with you on that.
How about Stacy Holt at Root for Kids? You're an RN. You probably have some of the first meeting people. What are some things that you might do?
I do. I try to make sure that when I get a referral for a new family, that I ask that specific information. A lot of times we'll get lots of demographic information, like phone number, contact information for a family, but sometimes the referring person has left out what their primary language is. So I try and figure that out beforehand. Mostly because too, I am not bilingual. And so if they are Spanish speaking only, then I'm going to need help. And I feel like a lot of times, if I don't have that and they're not responding back to me, that is usually the reason why I'm not getting a response.
That's a great one. Anybody else have any thoughts on that first question? Jordan, Thomas.
I think I wouldn't say cheat on this, but I am bilingual, so I can speak Spanish with families. But that is another, I think, building on what everyone else has said, it is hard because you don't want to just go in and make that assumption, even where I can speak both of those. It's not only embarrassing for the family, but it can be embarrassing for me if I start out in Spanish and they respond in English. And so if the people or the intake staff haven't gotten that first language or that primary language, it's a little bit of an awkward start, but I always try and ask and see what their preferred language is. And then a lot of times, because I don't look like I speak Spanish, they'll ask me where I learned Spanish. And I just try and be open with them and let them know like where I learned Spanish, how I learned Spanish, how I love to use Spanish working with Latinx communities and things that way. But also just trying to really make sure that I listen to them. That's a big one. A lot of times when I'm working with the Latinx community, a lot of them have reported that they don't always feel like they're heard when someone from early intervention or anything like that is coming to their home using either an interpreter or not an interpreter. Sometimes they feel like they're kind of just mown down if that makes sense, like they just kind of run over and don't always feel like their concerns are heard. And so I feel like really giving them the floor and the time to understand, to help me understand what's going on and what they would like to work on and work with has been huge and really key on building those relationships.
Yeah, great point. The next question is, how can our offices or buildings be welcoming to Latinx, Hispanic families and children? So, Amy, what do you think? Amy Simpson.
So I just have a very, very small Hispanic population where I live. And we have something called Montana Migrant Council. And so I do my home visits with them so they can translate for me. I actually only have one Hispanic child on my case right now, on my caseload. So
Tell us all a little bit about it was.
the Montana Migrant Council.
Yeah, tell us all a little bit about that.
I'm not exactly sure what all they do, but I know they provide healthcare, translation services. I'm not sure if they do like transportation, but it's just a little community place in Dillon, Montana, that I am lucky enough that they translate for me. And they've been doing that for years. And without them, honestly, I don't know what I would do as an FSS in my small town.
Yeah, that's a really great way that families can access that group to feel more supported, which I think Jordan was talking about, that sometimes families don't feel supported.
Right, and I think it's kind of a little community there too, meeting with them. So it's great for the families too.
Yeah, well, that's awesome. So before I call on anybody else want to just volunteer an idea about how we can be more welcoming?
I was just wondering what that migrant community resource did to just develop rapport off the get-go.
Oh, sorry, Crystal, you cut out on the very end.
Just what they do in their first visit to develop rapport when they're translating.
Well, I was lucky and unlucky enough to have them already on services when I took over their case. So the family was already comfortable with their translator. And so me coming in new, they already had their rapport. And so that helped, with me coming in with the professional and the parent already kind of on the same team. It was easier for me to jump in and just take over what the other FSS had been doing.
Yeah, so you already had that. Yeah. You've not had the experience so far, Amy, of having an initial one, it sounds like.
No, I haven't. We just have migrant workers in Dillon. They come seasonally. And so, not a lot of Hispanics on my caseload at all. I mean, even I've been here for 8 years and I've had that one.
Wow. Do you have other populations that you work with?
In Dillon, Montana, no. I have that one Hispanic family. And that's really the most diverse I've had in Dillon. We're a small town of like 5,000. So we don't have a lot of diversity there.
Okay. Well, thank you so much for sharing. Anybody else have thoughts so that we can learn how everybody else does it? Heidi, what about your group? Heidi Jeffs. What are some things that your group does? Maybe Heidi, didn't hear me. So how about Ashley Sparrow? I know it's always so hard to come off mute, but we learn so much from each other. I always take your guys' ideas and utilize them in my programs that I do. Ashley, oh good, thank you.
Hi, sorry. I don't know. I'm not Spanish speaking, but I know we have a pretty high caseload, and we do have a couple providers that do speak Spanish, and then there's an SLP who's learning Spanish. So they team together a lot.
That's a great way to do that too. How about, does everybody use interpreters, or do you guys have a company that you use, or do we always rely on younger or older children?
We use our staff. I think it's inconsistent to hope that the parents have a child there that can translate.
Yeah.
And we haven't had a lot of success with interpreters.
This is Erica Peterson. I'm part of the same team. Heidi's also on our team. Heidi Jeffs that you were talking to, and then Ashley and Crystal, but I'm part of the planned language committee. And so we actually have a committee that we've put together and have designated just, sorry, I've got a cold today. But we have a committee that we are working on ways for better approaches, making sure we get all of our materials translated appropriately, and how we can support our non-English speaking families. And we've looked into some resources such as because we have some that, it's not in that Spanish. We do have Spanish speakers, and usually we will pair our Spanish speakers with our Spanish speaking families. And we really work hard to do that, but sometimes it's hard if there's a language that nobody else speaks. So we are currently reaching out to companies on that language committee to find the best, most reliable forms of support when there are other languages, and how we can help make those families feel more comfortable and give the information in their native language.
Well, so your group actually has a whole committee that is just dedicated to work on that engagement.
Yes, and we've gotten together and we team and do trainings at least once a month, sometimes more. We put together a presentation on cultural competency, and we are constantly working through. So we work in tandem with the Early Head Start program, and they have program evaluations for how well we're meeting each one of those needs for different cultures. And we go through and have rated each program individual and then program as a whole, and looking at areas where we can make improvements and working on ways to make those improvements and how to implement them.
Wow, that's amazing. What a great idea or thought to kind of increase that cultural awareness within all of those programs, as well as a dedicated way to keep reaching those families. Kudos to you guys. That's awesome.
Thank you for sharing, Erica. I didn't even know that we had that. I've had a family that speaks Mandarin, and we used a lot of body language and broken English from mom. And then I had one that spoke Farsi, and we used an older sibling. So that's good that we have that, Erica.
Yeah, do you remember when we did the presentation? It was Carolyn left now, but Carolyn and Callie and all of us are on there. And when we did that presentation and each took our parts, were I don't know if you were there, but the
I
language.
must not have been there, but thank you for all your hard work.
But there's a couple people, I think, like Emily Swain and then one of our nurses, we have a couple of people that have experience with Mandarin, I believe. We looked into that after. So, and then we were looking into an interpretive services for like those other, like Farsi and that. So we're in the process.
Yeah, because I mean, even though like this focus today has been on the Latinx Hispanic population, each population has their own kind of culture as it comes to dealing with delays and disabilities. And so understanding that cultural awareness is like, that's just a fantastic idea. I really like that idea, Erica. Where are you guys from? Remind me. What program?
Group for Kids in St. George.
Group for Kids in St. George. Okay, so see, we might have to reach out and say, how did you guys get that started and get your leadership to buy in? I mean, Crystal's on the call. I know she's just a great leader. So other things that you guys do to help support, either obtain a interpreter or other suggestions when your staff is not bilingual and an interpreter is needed, that you guys have success with?
One thing I think to consider with making families feel comfortable is, consider our marketing materials and our photos and our toys and things that we have at our centers, and whether or not they look like the population that we are trying to serve.
Yeah. And how do you guys do that, or anybody on the call, like where Amy, you were saying you only have one family that may be Latinx? How do we make sure that that happens to everybody? Ideas or thoughts that you guys have around that? It's hard, isn't it?
So one thing we do is we take pictures of our own families at activities or our home visits, and we use some of that. So they're not necessarily all stock photos, but there is a bigger range of stock photos of diverse populations now than there used to be. I mean, I think the last couple of years has really changed that for us. But I know we were looking for some Native American stock photos, and it was a little tricky to find families and young children, but we did.
That's awesome. Jackie, you were gonna say something.
I was. Unfortunately, I do not speak a second language because for a lot of reasons. But when I went in, I just had one Spanish family that I've met over the 8 years that I've been here. And they spoke enough English that we could get by. While we were there, they were very concerned that their kids were developmentally delayed. And one of the things that came out was that, if you are learning to speak 2 different languages at the time that you're going into that first, toddlers and just starting to speak, it takes about 3 years for you to get all the rules of both languages and be able to speak like other 3-year-olds would be doing but then you're able to do it in both languages. So it's really a celebration if they're coming to our country speaking of one language and then learning to speak English on top of that. For a lot of reasons, Alzheimer's is not as prevalent in people who speak 2 languages, the percentage and stuff. So it's just something, a little bit of extra stuff that you come along with. And I told them that, I said, you know, you're doing a really good service for your kids that they're going to be able to speak 2 languages. One of you speak in Spanish, one of you speak in English. They're going to be able to do it because they had all of the extra skills that they had to go along with it. I said, they're going to do it. And I was absolutely sure because of the things that they were doing with the 2 languages at that time. But the pediatrician at the time, and thank goodness she's there because she's pinpointed a lot of kids that need to come to us. She said, you know, the developmental delays seem to be there with these 2 kids. And when you went through and you actually looked at it, they had some of the skills in Spanish and some of the skills in English, and they were developing just fine as they were going.
Oh, that's a great point to point that out and talk about that. Cool. In the comment, Kim, do you want to give any more clarification? You say that there is a phone app. Is that for greeting families or?
So like if there's no one in the office that speaks Spanish, one of the moms showed me one time, she's like, this is what I do. So she'll put it like on Google Translate, what she needs help with. And then she'll put it in Spanish and then push whatever to translate. And I'll say it in English. It's not like the perfect translation, but that was the only way she can communicate with the clinics.
Has anybody tried that Google Translate before with success?
I've used it in clinic mostly for just like non-urgent things or like a checking in at the front desk rather than waiting to get an interpreter on the phone. Or, you know, if I just need to tell them, I need you to sign this form and this is what this form is for. I've used it and I've had patients use it where, you know, like Kim was saying, they pull it up on their phone and they're like, here, this is what I'm trying to communicate. And I think it works.
Yeah, I know I used it when I was in Italy and I needed to make sure I was on the right train. Ashley.
I was gonna say, we used it when I worked in the hospital. We had a translation service that we would call, and it would say, you know, all the different languages. But then if we knew the patient and had established a relationship with them, then we usually would just use that Google Translate if we weren't doing like trying to explain new things.
Yeah, those are great ideas.
This is Erica for Kids Again. I was gonna say, I think Rita's on here, but I know she and Carolyn for a while were looking for Spanish books because they were doing a Spanish reading time for those families. I don't know if that got brought up. I had to briefly attend to my daughter who fell down the stairs, but did that get talked about?
No, but you're attending to your daughter that fell down the stairs was a much better use of your time. But so they did a group activity with Spanish books.
Yeah, trying to make sure that they had that and then exposure to that in like the print in their native language and doing that way they could engage with the parents more that way too. I thought it was super cool.
That is very cool with it. So as the presentation showed, but Kim reports that radio worked really well for their group. How are some other ways that you get the word out to different populations? What's the best way that you guys have all found success with it? So I'm going to share another thing just because it came up in that survey. We did a survey similar to this with 2 other early intervention programs. And all of the families, not all the families, but a high majority of the families did report they get a lot of their community resources from the WIC agencies and the WIC programs. So we've worked to send out materials to the state of Utah WIC offices, as well as then individual early intervention programs brochures. It was a really interesting thing that families were getting that information from WIC. Anybody else have other places? I know you guys reach out. It's hard to think of that, huh? Okay, well, like I said, you guys have such a wealth of information and knowledge. I'd love to just hear how everybody else is doing that. So thank you very much for sharing your ideas and joining our call today. We do have other ECHO sessions that are going on. If you've never joined our early ECHO in September, we are going to be talking about newborn health screening. So if you want to learn more about that, please join us. And I'm going to give you guys back 15 minutes of your day. So enjoy your time, and I'll be sending out those surveys. So take a minute to fill those out. Thank you so much.